off the top, we're very happy today to have Dr. Steve Mulholland here, and he had a client named Dale. When Dale came to see him, she wanted her pre-baby body back. Can you relate? I can. Let's watch her transformation right now.
Hi, good morning, Dale.
Hi.
Hi, Dr. Mulholland's ready to see you.
Great.
Okay, so come on back.
Hoping that I can get back the figure that I had before I was pregnant, because I found that after the pregnancy and breastfeeding, I lost all the volume that I had in my breasts. Now they just sag. And then around the middle as well, I feel the skin's really stretched out, and I'd like to be able to tighten up the skin in there a little. But I am working out 3 to 4 times a week, running, doing the sit-ups, the weight training, but it's just not showing in my body overall. I find there's just those certain areas that I'm not getting.
On the tummy, just bend down just a bit. That loose stuff right here is where we're going to do some tightening. We're going to do some subsurfacing or subdermal laser tightening, and we're going to remove a little bit of that skin and tighten that for you. As with many young moms who have had their children, it's not so much about trying to look younger. It's just trying to recapture some of the body they used to have. You expand, contract with pregnancy, and you wake up one day, your kids are off to school, and you look in the mirror and it's like, usually what I recommend is a nice teardrop-shaped cohesive gel implant. And then we do what I call a smart lipo-assisted mini tummy tuck, meaning we only use the C-section scar. We remove a little bit of skin, and we do what's called smart lipo up on the tummy and the hips, which is using a laser to melt the fat and to tighten the skin at the same time. So we get a nice, tighter tummy, very little scar, very little downtime, and a nice breast shape.
So many of us have been in that same situation. And, you know, my answer is after you have a baby, just never bend over and never sit down. And then your stomach is always totally flat.
It's a cheaper solution.
That's a cheaper solution. But your solution works very well. When we see the afters, we're going to see sort of the full effect. How often do you get women in that same situation?
It is probably the most common patient I see. A woman between 27, 28, and 45 to 50, had 1, 2, 3, or 4 children, has devoted her life to reproductive medicine, and now looks in the mirror and wonders where her body went. So it's almost like aesthetic reconstruction. It's trying to recreate or grab onto what one once had, a tight, firm tummy and body, and breasts that match your figure.
Is it ever doable? Like, are we ever really able to get back to that tight tummy without a little bit of help?
We can get very close to that 25 to 28-year-old figure you had pre-baby. We've got a lot more aesthetic solutions, a lot simpler solutions. It's been an amazing renaissance for the postpartum mom.
Now, for her, she said that she had worked out and everything, but there was always a little something, and she had had a C-section. Does it make a difference, do you think, whether it's a C-section or it's a different sort of birth, a vaginal birth? Does that make a difference in terms of the elasticity in your stomach?
I don't think it makes a difference on the condition of your tummy post-baby. Some of our incision ports or access positions are easier with C-section, but whether it's normal vaginal or C-section, the common complaints are loose skin, stretch marks, no muscle tone, and this bulge with a little bit of fat and loose skin you can't exercise away, or breasts that just deflated in front of your eyes, and so you wear an evening gown and there's always that little wrinkling and no fullness up top, or you wear an underwire push-up and there's nothing to push up, or you just want to wear a tank top with nothing on underneath and there's nothing there.
Are you kidding me? With nothing on underneath?
Absolutely.
Yeah, those days are over for me, my friend. I remember them, though. So what I found interesting about that tape is that you said you actually go through the C-section incision. So,
you know, the common points that we go in to do this smart lipo or tummy tightening with lasers and probes, the belly button, through pubic hair, through C-section scars, so very unobtrusive. Certainly more so than it used to be with the big tummy tuck scars.
Right.
The breast implants, we're going to talk about that later, but there's many stealth ways to go in and bring back that volume.
Excellent. Well, you did a really, really good job. So Dale, as we mentioned, wanted to restore her body to her pre-baby look. Let's take a look at the results.
Dale, it's so good to see you. You too. How are you? I was just looking at your pictures and admiring your post-op outcome. Come on in. Let's have a look at them. So Dale, it's 8 weeks after your surgery. What do you think?
I love it. I think it's great. I couldn't be happier. And yeah, I'm No complaints at all.
If you look at the pre's, you can see it was difficult for you to fill a bathing suit.
Definitely,
and
yeah.
we've got a nice little post picture here. It looks like a natural breast.
Yeah.
It doesn't look
definitely.
fake.
I feel great right now. Honestly, though, I think for the first couple weeks before surgery, I was on an emotional roller coaster. Of course, I was usually excited and couldn't wait to have the surgery done. But there's also a lot of times when I was feeling really anxious, very nervous, and almost getting cold feet at some points, mainly because I'd never had surgery before, and I didn't know what to expect. I was worried about what the results were going to look like, but also worried about the recovery, worried about any possible complications. But now, 2 months later, I am so glad I had the surgery done. This body makeover was probably one of the best things I could have done for myself. I love the results. I think that Dr. Mulholland exceeded my expectations. I had hoped to regain back the fullness that I had before pregnancy, and I think my body's even better than it was before I was pregnant. I love it. I had my 40th birthday this summer, and I think I look better than I did in my 20s.
Now that's good work. She feels better than she did before the baby. That's amazing. So you've got some befores and afters here.
Yeah, I think this really highlights and will resonate with any woman that's had children. You know, that bent over and it's kind of a little loose.
Yeah.
That's very easy to fix now. So, under local anesthetic, that's the other thing. You don't need a general. You don't need to stay overnight. It's very quick, relatively painless. This little post-mummy tummy, usually below the belly button or the little wrinkles above, and when you bend over, it's loose. It's just not as sexy as it once was. So as you said, you never bend over and you never sit down.
Like I am right now.
This is her bent over view after. You see it's nice and tight, more pre-babyish. And you know, I think having children is great. Sometimes it ravages the body, and we should take pride in being moms and dads. But you don't have to live with the consequences of childbirth anymore if you don't want to.
Well, the other thing is you're going through so much hormonally as well. It's really tough to get used to your new body. So it's nice if there is something that can help you sort of get back to the way you were, the way you liked your body. How long did she wait? After she gave birth?
Yeah, she was about 4 or 5 years after. I mean, she worked out and dieted, hoping, as many women do, I can do this. I can exercise through my loose skin, stretch marks, and that little roll. And so I never advocate doing any kind of procedure within a year of breastfeeding. Not just childbirth, but finish the breastfeeding, because that estrogen progesterone has an effect on your skin. Right. So that all the dust settle, let everything just deflate, droop, and sag. Try your best in the gym, and some people do. They have surprising genetic code, and their skin looks great after children, but some don't. And so wait a year, see a cosmetic plastic surgeon you feel comfortable with, who offers you minimal invasive and options in restoration. So 1 year.
How long for recovery for her? Or in general?
You're up and walking that day nowadays. You're up and moving that day. Nothing heavy lifting for 3 weeks, but you're back to your normal lifestyle within a month.
All right, you have brought down a fantastic gift for everyone in the audience. I think you're really going to like this. Dr. Mulholland has brought down a $100 coupon and some SpaMedica skincare products for everyone in the audience. So if you wanted to, you could go and get one of the non-invasive procedures, put this towards anything you want. Thank you so much. That was a really good lesson.
Today on Cityline, it's Makeover Madness. Bill Rowley hits the ice with tips for your winter hair.
Moisturize, moisturize, moisturize. And maybe learn how to skate.
While Dino tackles chapped lips, we take a look at a post-baby tummy tuck. Plus, Dave Lackey brings us his spring beauty picks. And wait till you see these transformations. Right now on Cityline. Coming up, a mommy's tummy tuck.
All loose skin, that's courtesy of 3 or 4 children. The children are great, but they sometimes leave devastation behind them.
Yes, they do.
Well, I think we've all been there. Amanda was feeling a little self-conscious about her post-pregnancy body, so Dr. Mulholland gave her a new mommy makeover. Take a look.
Have a seat and relax. So, pleasant young lady, you've had You've had a baby now. How old is your child?
She's 3.
3 years old. Breast augmentation is extremely common. It's number 2 right after liposuction. As women nowadays are entering into their postpartum years, they've had their kids, they are healthier than they've ever been. They diet, they exercise, Pilates, yoga, but they look in the mirror and what they can't bring back is what babies and breastfeeding took away. Before you had children, you had a fuller upper pole of your breast,
Absolutely.
a little perky. You're always smallish, but you always had a perky, fuller breast.
Exactly, yeah.
You're so used to having like a tight little figure to you and really not having to work too hard at it. I didn't feel as sexy, I didn't feel as desirable anymore, and that did a lot to me.
So would you agree that's the area that's been frustrating on the front?
Absolutely, yeah.
She's worked out like a fiend. She's exercised for 3 years. She's down to her ideal body weight, and she has a nice figure, but she's bothered by a little pot and some love handles around the sides. So the most important principle of lipo today is get reciprocal contraction of the skin with removal of the fat. So you have a thinner contour, but you don't make a granny tummy. You want to make a youthful tummy, which should have tight, smooth skin. For the breast, obviously if you've lost the volume, you're not going to be able to get it back. There's no magic pill of breast augmentation. But breast augment surgery's changed significantly in that you can choose a shape, either teardrop or round, and a size that fits you. And we do that through a special imaging machine called the VECTRA 3D. Nowadays, the telltale signs, which are visible incisions, we give lots of options to patients. Often under the breast has turned out to be one of the best approaches. It's become a very safe operation. It usually performed in under an hour, not even under general anesthesia, like twilight sedation, like having a colonoscopy or having a dental wisdom tooth extraction. It's good to see you again. How many months is it now?
It's been 4 months.
4 or 5 months. Okay, great. So are you happy?
I'm so happy.
Right.
Ecstatic.
I completely refound myself, and people have noticed a change, especially in my personality, my sense of humor, my overall being has changed since having this done.
Okay, I think she hit the nail on the head there, Amanda, at the end when she says people have noticed the change, but you notice she said in my personality. So a lot of people will look at her and say, okay, her body was already great. Why is she getting anything done? But sometimes it's a psychological thing. It's not always a physical thing.
Yeah, she didn't have a huge change in her figure.
Yeah.
A little bit of fat reduction, skin tightening, and a small augmentation. And if you didn't know her, you would know because she's wearing push-up underwire bras and wearing support Spanx.
Right.
But now she could wear what she wanted, tank top or an evening gown, feel sexy again. And the biggest change was in her perspective, in her perception, and how she carried herself.
Right, okay. So a lot of people will be at different stages with their body after they've had a baby. Some people will be the Amandas of the world. Some people will have, have put on a lot more weight. Hello, 60 pounds if you're me. Do you wait until you have had all of your kids before you look into a new mommy makeover?
It's a great question. I mean, Amanda is the one side of the mommy makeover, what I call the mommy mini, where she's had one child out of a relationship, not sure she's going to get married again or have kids. She's in her mid to late 20s, has a few frustrating changes. She has an operation that takes an hour and 15 minutes, does it on a Thursday, back on a Monday. That's for the mommy minis. Now, if you've had 2 or 3 kids or you're planning 2 or 3 kids and there's a lot of changes, loose skin, breast deflation, then you're probably best to wait because if you have more kids, it may alter your surgery. And that would be more the mommy major, which would be the typical tummy tuck, the body tight type of lipo, and some breast surgery, so some breastwork, lipo, and removal of skin. And usually that mommy major is best to wait until the end of the kids to do that.
Okay, all right. Now, we've got some examples of people who have gone through bigger transformations as well. And these are also mommy makeovers, but these would be more of the major
That would be. So this lady's got a lot of loose skin. Her muscles are weak. She's put on, had 3 or 4 kids. That's really a 3-week recovery. It's a huge change.
Yeah.
And she waited to the end of her childbearing cycle. But there's so many different types of women now in relationships that to force them to wait till they're 40 or 45 means their entire late 20s and 30s may they not feel as sexy sexy as they want to.
Right, so you advise maybe stick with a mini if you're thinking maybe you're going to have a few more kids. So here's another really drastic change here. Same woman.
Yep, a lot of kids, a lot of loose skin, diet and exercise. And again, now she needs the help of plastic surgery to take where diet and exercise got her. She lost a lot of weight, but that's just all loose skin. That's courtesy of 3 or 4 children. The children are great, but they sometimes leave devastation behind them. Yeah.
Yes, they do. Okay, let's talk a little bit about procedures. There are some that are more invasive than others. What are some of the options out there when it comes to the tummy tucks and the breast augmentations?
So Amanda was on the mini side, and generally with modest loose skin, a little bit of fat, we have products like that Body Tight that you saw moving back and forth. It removes fat and tightens at the same time, but no big incision. And so you could do your procedure on a Thursday, be back to work on a Monday without much downtime.
Okay.
Breast surgery's changed totally. Most women are always afraid, geez, I wonder if I pick the wrong size. With that new VECTRA imaging, 3D imaging, it's like going to Holt Renfrew. You see a number of dresses, you think, that's going to look good on me. You try it on and it sucks.
Right.
So you have to try on a bunch of dresses. Now with the implants, it's the same. You can pick a bunch and pick what fits your sense of sexy. She chose a very small implant. It was a 45-minute procedure, and it gave her that little bit of upper pole loss that breastfeeding took away from her, and no amount of diet and exercise is going to bring that back.
So how does that work then, this vector system? Is it just a computer imaging?
Yeah, it's a computer imaging based upon a lot of software data. So we take a bunch of points, the computer does immediately, and based upon a bunch of before and afters can predict very, very quickly what you're going to look like. So it's like watching Dexter season 8, and you have a person's face, you want to know what they're going to look like, you know, a year later or 10 years later. The software will do that for you.
Okay.
It's very cool because it removes the biggest fear.
You can try on boobies.
Yeah,
is what
you can try on breasts, like trying on a dress.
And figure out which ones you want. What are the, if there are any, risks, and who might be the best candidates for this sort of these sort of procedures?
It's very important to remember this is not non-invasive stuff. There are risks, anything from major to minor risks of any surgery. So it's important that the surgeon spends time going over those risks. They're very rare. But someone needs to be prepared to accept the pain and discomfort of surgery.
Yeah.
The mini, you can sort of be back to work feeling uncomfortable in 3 days. With the more mummy major, you know, the tummy tuck, the Body Tight, the breast work, you really need about 3 weeks off, and that's a big commitment.
Right.
So the risks are acceptable, but they're not negligible or irrelevant. So a good candidate understands the risks and the benefits. They know what they want to achieve. They come in, they get some imaging. We know that their expectations are realistic, and that's the biggest risk, that someone's expectations are here and the outcome's there. I do a good job, they look great, but they wanted to meet Brad Pitt. Well, that may not happen.
Yeah, and I mean, the good thing now is that you have technology to back up what they're going to look like, and I think that really does good in terms of keeping expectations where they should be.
Correct, yes.
Okay.
So.
Dr. Mulholland has brought everyone in today's audience a $250 SpaMedica gift certificate and Vivier Skin Serum 10. So it's an oil-free, medical-grade serum that helps reduce the signs of environmental damage, such as fine lines and wrinkles and uneven skin texture. Thanks so much for that, Steve. Let's go to break. We've got more coming up. Stay with us.